Greetings everyone, today I am presenting issues related to the migrants and threats to healthcare in Malaysia. The first issues is lack of access to healthcare. Migrant workers' barriers to healthcare access are attributed to their lack of familiarity with the healthcare system, language barriers and lack of awareness of their rights and entitlements to healthcare as provided by their medical insurance, and fear of deportation among undocumented migrants. They are also the most under-researched group, hence making development of interventions specifically targeting them difficult. Their illegal status also caused them to not dare to seek legal redress from any unjust treatment too. Besides that, most migrant marriages are conducted through customary or religious rites, solemnized by people in their community. These marriages are not recognized by the Malaysian laws and causes registration problems of children born leading to stateless children or children without documents. By 2009, there were approximately 52,000 stateless children in Sabah. The concerns surrounding these children are that they are not entitled or have very limited access to public health and education services. Studies have also shown that migrants have low utilization of public outpatient healthcare services and late initiation of antenatal care. In a study conducted among local citizens and migrant women in Sabah, it was found that migrants who attend to their antenatal care only do so when their pregnancy was as late as 7 months as compared to local natives who initiate antenatal care in the first 3 months of pregnancy. The next issue is financial issues. Cost is a significant barrier in accessing healthcare services for migrants given their low wages. The Malaysia's double fee policy further compounds migrants' access to healthcare services. The policy requires foreigners to pay almost double the amount or even more for treatment fee paid by a Malaysian. For example, they have to pay 15 ringgit for consultation with general practitioner and 60 ringgit with a specialist, while Malaysians only pay 1 ringgit and 5 ringgit for the respective consultations. There have been reports that migrants who were hospitalized absconded before being discharged, which causes loss of follow-up, and the migrants might suffer from complications of the diseases due to incomplete treatment. Migrants are also vulnerable to certain health issues. Both commercial sex and the domestic migrant workers are at risk to unwanted pregnancy, unsafe abortion, sexually transmitted diseases and issues relating to their sexual reproductive health. They are at higher risk to diseases than local sex workers or domestic workers, as they are usually least powerful, and their access to services and information is often limited by lack of civil and legal status. In Sabah, undocumented migrants, who are often poor, do not practice contraception, do not receive antenatal care, and often deliver in an unsafe environment conducted by untrained birth attendants. They often present late with complications and have very poor outcomes that leads to neonatal deaths. Documented migrants accounted almost 10% of maternal deaths in Malaysia, and this occurred especially in Sabah, while the figure for non-documented migrants was higher in 2012, set at 12.8%. The maternal mortality rate in Sabah is the second highest with 42.1 live births in the country. Besides that, migrant workers usually come from background of economic hardships, and due to their lack of knowledge, skills and resources, hence they are usually employed for occupations with higher risks of work-related injuries. Besides that, poor housing, sanitation and living conditions are also faced by migrants. In Sabah, 35% of cases in major outbreak of cholera and the majority of deaths due to this illness, consists of 69%, have occurred among migrant workers. Outbreak of measles in Sabah also occur in migrant settlements and among foreign workers, who live in poorly served shelters at construction sites. They are housed in cramped, poorly equipped and ventilated and/or unhygienic living quarters, with inadequate nutrition. They are also have increased risks of other communicable diseases, such as tuberculosis and hepatitis. Negligence by employers is also another issue to be highlighted. In the event of disability or death, migrant workers are eligible to be compensated from their employer under the Workmen's Compensation Act. However, this is only provided if the employer purchases a medical coverage for the migrant worker, as they are to insure their liabilities under the Act. This scheme was said to encourage high liability for employers. Therefore, Some employers may not purchase medical insurance for their employees nor pay for their medical costs. Perception that migrants are merely short-term labor investment and a commodity leads to health and occupational safety often being neglected by employers. In addition, policies and laws are issues faced by migrants too. Rather than protecting migrants' health and rights, the purpose of our country policies seems to be controlling the migrants from having any negative impact on the locals, and undocumented migrants who are not protected by these laws and policies form the most disadvantaged group, and their presence is even criminalized under the Malaysian laws due to their legal status. That's all for my today presentation. Thank you.